Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm here with the CEO at 1upHealth, Joe Gagnon. How are you today?
Excellent, Jared. How are you?
I'm doing well. It's been an interesting year, obviously. So just for everyone hearing this, we're recording this kind of right before the holidays, but we're super excited. I'm super excited to talk with you, and you're in an area that I love so much in Seaport right now. Definitely can't wait to get back out there, and mainly for the food. I love the food out there. I love all the different food options and walking around, but super excited for us to have the opportunity to chat, Joe. For the audience that hasn't heard about you, if you could give them kind of the quick intro on yourself, and then we'll talk more about 1upHealth, and then you and I had a couple topics we wanted to kind of dive into today.
Yeah, that's great. Thanks, Jared. If I think about my career, it's really been focused on sort of early stage companies going from the startup phase to the scale-up phase, and bringing expertise and experience in having done that. This is the fourth time I've had the opportunity to do that, in a variety of industries. So I'm, healthcare knowledgeable, but more than anything, I'm a sort of a scale-up, growth-oriented person. What I love doing is working on bringing new ideas to industries, right, where we sort of get a little bit, probably stayed in our thinking, and we need to sort of change how we think. And so that's what I'm here to do. In addition to having the opportunity to run companies, I also fancy myself an ultra endurance athlete, an author, and an adventurer. So I spend a lot of time, outside the office setting, whether it's running around the world or, taking on big challenges. I like the combination of sort of pushing yourself on all levels of life.
Yeah, it's not enough just to go kind of all in one area, right? Like you need to, whatever you do, go all in on it, or don't do it at all. That's kind of been always my mindset. Mm-hmm. You owe it to yourself, right? If you're not going to give it your all in whatever you're doing, and also that the growth that does for you, not just mentally but physically, as you were saying too. It's crazy when you're able to kind of really push yourself in these different, and I'm sure it's continued to allow you to grow as a human, right?
Oh yeah, there's this many concepts we could talk all week about, but it's like I believe a strong body carries a strong mind and a strong soul, and you have to have a place for it all to sit. And there is a process that you go through every time you do physical activity that sort of works through the biochemistry of what we are that balances us out. So to be the CEO of a company or to lead anything is a lot of pressure and a lot of strain because you have a lot of responsibility. And if you can work through that on an early morning run or a bike ride or a walk or a hike or anything that gets the blood flowing and your body's sort of attuned to the world, you have much better chance of being more balanced, more thoughtful. It can be even meditative, right? And so I've been on this journey for, almost now 25 years. And, I made it through the pandemic because I was running 10 miles a day and I had to win every day, and so I was able to keep balanced and not feel the strain and the stress because I didn't let all of that just sit on top of this structure. I actually processed it every day. It really works well.
Yeah, it's you just feel so good, and I like those inner conversations you have when you're going for a run or something like that, right? It's that time of reflection. It's really one of the few times in the day that you're truly alone, unless you're running with people, right? Because even if there's people by, or you're running right by them, you're not going to. When you're in full run mode, right? You're not having these conversations with people or stopping. You're just going all out until you hit your goal.
That's right.
I love that. Can you explain a little bit how you kind of? I know you gave a good intro on yourself, but kind of how you started pushing into healthcare.
Yeah. So, the connection throughout, I think, all of our lives is about a set of relationships that we build where people get to know your capability. And, we like to form teams with people we know that can get the work done. So I got involved in 1UP because Jackson Square Ventures, it was the lead investor in the A round. I was the CEO for one of their other portfolio companies, and they introduced me to Ricky. And what we decided, Jared, was to do something different, right? Which is that we would combine my operational and go-to-market expertise with Ricky's technology and product expertise, and that would give us an advantage in the market. We wouldn't try to, sort of be so broad and diffuse as a leader that we don't play into our strengths. And so what was appealing to me is, I've been on this life journey to think about how to optimize my potential and the potential of the people I work with. And this platform, 1upHealth, says that we can help the rest of sort of our community, broadly speaking, at least in the US, start to think about how data can enrich one's life. Better health leads to a better life. And sort of the obstacle to that is the accessibility of data. And so I was really intrigued because I use data every day. I wear these 2 watches to track what I'm doing. I know everything about sort of my physiology and how that will relate to my performance. And we can do that with this business because really the fact is that healthcare data is tracked in silos. It doesn't allow us to scale. It doesn't allow us to think real time. And I knew wow, if I could do this with Ricky, this would be just an amazing opportunity for us to change people's lives, industries, and, really do something for the planet here.
Absolutely. Yeah. But by the way, before we go into some of these questions, I have to ask, why 2 watches?
Well, one is I'm always trying to get sort of a cross combination of the sensors in the different watches to get a better reading, because one on its own might get some, incorrect data. So between them, I have a much better, it's almost like triangulating on data. So this way I can understand heart rate, I can understand strain, I can understand, because they're all slightly designed differently, but between the 2, and I've been doing this for years, I can see the data better as a result. I'm a bit of a data freak, so I love this stuff.
Yeah, I like it. It's you're the first person I've had the opportunity to chat with that has 2. I need to get 1 now. Now I feel I don't have 1. I did at some point. You do feel better though when you have the information, and it's just like when I'm writing down stuff for my diet and when I'm writing kind of what my activities are. You just feel like you stay more on track, right? When you have access to more information, you feel better about what you're doing because you can kind of take that data and then look at hey, am I seeing results? Am I feeling better? All right, I'm going to go. I think I'm going to have to go buy something after this call, to be honest with you.
All right, we'll talk about that.
So a few of the things that we kind of want to talk a little bit about today, I'm going to go into a couple questions that I had for you, and we can kind of just have a conversation about it. But I want to talk a little bit about basically ONC and CMS a little bit. And my question for you is basically, what effect are the ONC and CMS rules having on the industry's commitment to interoperability?
Yeah, it's interesting because if you think about life broadly, habits are really hard to change, right? Once they're formed, they have all this foundation in either good or bad reason, but they're hard to change. This industry has grown up from, paper medical records to sort of an approximation of a paper record in a digital form. But really, at the end of the day, it's not an industry that understands how to share data. And ONC and CMS realized that they needed to lever some change into the industry, right? They were going to use their control system into the Medicare Medicaid marketplace to say, you guys are not doing a good job of actually leveraging all this content for better health. And so we're going to sort of force your hand on that. So they have used their leverage to start us on a good path. It's sort of like, when we tell someone you should eat sort of, superfoods like broccoli or kale or blueberries, it's hard to get people to do that. So you have to find a mechanism, and sometimes you have to force people in the beginning. Then they realize, wow, I feel better eating better, and I'm going to feel better sharing data. And without ONC and CMS, the industry itself was not going to sort of change. This was absolutely necessary.
Absolutely. Yeah. Can you relate that back to, now I always like to ask, so just industry opinion at large, but can you tie that back to, I guess, 1upHealth and what you've been building over there?
Yeah. So, if you look back at the origin of the company, we built APIs for patient-mediated access for app developers. So it could have been 23andMe, an app developer, could be Apple Health. All of them need an API to be able to access clinical data in a medical record system. So we built that API, and we have been in that market. We had over 100 app developers using our product. And then when CMS came out with the regulation that said on July 1st of 2021 that all payers in the United States were going to need to provide patient-mediated data access for Medicare and Medicaid patients, we pivoted the company into an enterprise space so that we could use our API and our platform to provide that capability for payers to be able to meet the regulations. And so, across the year, we had fantastic success. We have over 45 customers, payers around the country using our platform. We convert the data, we platform the data, we make it data accessible. And so we took their lead. And, early on, we got a lot of credit for having what was called sort of the best implementation of CMS's intent for FHIR data interoperability. And so we've been on a tear because we had the technology already in place, and then we pivoted to how to bring that into an enterprise. So it's been a busy year, but it's been great to be part of this journey and the tailwinds that were created out of Washington.
Now, when it comes to interoperability, are there basically lessons that healthcare can take from other industries? I guess that healthcare can learn from other industries?
Oh my God, it's such a great question, Jared. All of us, all consumers in the US, we've been affected by changes in interoperability in data that's changed our lives. Everything from pumping gas in a self-serve station required interoperability for finance and payment systems, right? You went into retail and now you can order something and have inventory visibility and it shows up on your doorstep tomorrow and FedEx is messaging you that the package arrived. That's all about data interoperability. On the travel and transportation side, you can go to booking.com or Kayak and you can see seat maps available across proprietary systems of different airlines. And you can pick your seat, you can pay the way you want, and you can actually price compare. All of that was about data interoperability. All of those changes in our lives that we now come to expect. And then in healthcare, if I was to go to my primary care physician and they recommend that I go for a colonoscopy, I might have to have the data faxed from one doctor's office to another. Really? The most important part of our lives is taking care of our health. And we have all these other ancillary systems that work well together, but in health, we can't move the data. We have to fix this problem now. We can't wait anymore. So that's what we're about. We need to follow the lead of where transformation has happened because data opened up and was interoperable across all stakeholders in an industry. That's now the mandate we need to go and make happen.
So kind of, tacking on top of that, kind of moving with based on that answer that you just gave, can you explain basically the role that the FHIRs will play in the future of interoperability in kind of making this healthcare data that you're talking about more accessible?
Yeah. So what FHIR is a data standard that ONC and CMS constructed to create a common language so that we could all talk together. So that if I was going to move a clinical file from a provider to a payer, we would have the same language. If I was going to have a consumer access their payer claims data, they'd have a common language. If we were going to connect into a clinical trial at a biopharma company, we would be able to have the same data format. So we now can express in the same form a language that allows this interoperability to happen, without which we had these interfaces that had to convert the data. Now we express it the same way. Now, there is a whole bunch of mapping of legacy data into FHIR. So you have a first step you have to go through. But once you have that, we can bring data together that's never even touched each other, like clinical and claims data in the same file for me, historically and current, is an amazing source of content that allows us to rethink how care is delivered, the cost of that care, et cetera. Without FHIR, it would have been necessarily impossible. It's like the web, everyone forgets HTML and HTTP and TCP/IP. All of this alphabet soup is a set of standards that allowed us to build websites and actually render content so we could all see it the same. And FHIR is doing the same for healthcare.
Interesting. Yeah. So that's when you're looking at kind of I'm not going to call it a barrier, 'cause it's not a barrier, but the basically new things that have been added that will make interoperability in healthcare become more of a thing, become more better structured. You're saying FHIR plays a huge role in that. Yeah,
actually, we think like there's some simple truisms like data done right. Look, I appreciate the legacy data providers who are working on what we have today, because they have to. There's systems that are in mainframe still, they're on client server environments, some are in the cloud. At the end of the day, it all needs to move out of that environment and into the cloud in the serverless world to make it easy to access and to run analytics against that. When you start to see not just where 1upHealth is going, but where the other leaders in this space will be, it will be against sort of serverless cloud data in FHIR format, so we can run modern day analytics against it. So we can actually create an environment. And look, patient mediated access, I don't even think patients know they can get access to data, but what happens when we do know that, right? What about a doctor who can share data with another clinician and get a better care outcome? And then even the payers, they want to give you a care plan that's better for you based on population health data. We could look for patterns. And so that can't happen in a legacy world, but that can happen moving forward with the kind of platform we have and what FHIR will do for us.
I want to kind of segment to still a related question, but how is cloud-based infrastructure helping scale healthcare's data sharing efforts?
Well, one thing is clear is that I think the world is moving to cloud, and there are some risks with that, by the way. We all know there was an Amazon outage last week, and there's stuff to worry about when the cloud runs everything. But to scale at the level that healthcare needs to, you can't do that without cloud. You have to have resource that you don't need to provision and implement. You need to have it available. Cloud allows for a whole industry to collaborate at the same time on a set of tools that we can all leverage. So we're not redoing at the infrastructure level or the tool level or even the deployment level, right? We can use common capabilities. Cloud allows for us to scale performance differently on small versus large. You can think differently. And it's not just Amazon, it's Google, it's Microsoft, it's across the industry. That what we're saying basically is that it's utility, right? We needed a power grid in the country to have utility so we could all have power to our houses. We needed a communication utility, AT&T, Verizon, and everyone lets us communicate. And now we need a compute utility in the cloud to allow us to platform the data and run analytics against it. And so while this utility is run by private companies, it is the mechanism to allow to democratize that access, scale it, have modern day, think about this. If you're a small company, you can access resources at Amazon, for example, that you could never buy yourself, like literally never. We get access to billions of dollars of R&D and capabilities of other components that allow us to do something faster, better than we could have ever done otherwise.
Thank you for sharing too. I had to make sure I asked you that question before we kind of wrap things up here. My last question for you, Joe, as we kind of close things out. And by the way, I hope I can have you on again in the near future, because we kind of went through a lot of stuff today, but there's so much more that we could go through, and we'd like to keep these not like super long episodes, but long enough that we know everyone listens.
Yep.
And my last question for you is basically what's next for 1upHealth from here?
Yeah. So, we've spent the past year platforming, over 45 health plans on a FHIR data platform. The next stage of this, in addition to continuing to want to do more of that, is to do extensive clinical data connectivity into those health plans so that we can combine this data together like no one's ever seen. And then put an analytic layer over that against a modern FHIR data platform that allows us to draw better insight in real time at scale. Like those words, we just say them, Jared, sometimes, and it's sort of like, oh yeah, that's hard stuff to do, but that's what we're built to do. We have an amazing tech team who is doing that in real time. Like we have over 25 million members on our platform and over 5 billion resources running today. We're doing it, and we're going to keep doing it. And, we're going to poke the bears a little bit and show them how, data done right makes a difference for all stakeholders, financial, health, operational. We're going to make this a better world, and we're going to be a part of that. And we're really excited about the next stage.
Yeah, I'm excited to have you back on again and kind of talk more about the company and the beauty about having, this is kind of your intro episode too, right?
Yeah.
Where our audience, many people already know about 1upHealth and what you're building, but for our audience, it provides a nice source for them to kind of learn the why, how, what of the business, kind of why everything got structured. A couple key things that we wanted to talk about, which we did. And next time we can go into some of those topics in even more detail. So really appreciate you, Joe, coming on the podcast, and can't wait to chat again soon.
Thanks, Jared. Have a great day and a fabulous holiday. And I really appreciate you having us on.